everyone, this class is about the exercises therapy used in orthopedics and traumatology. In the history development of orthopedics and traumatology of TCM, the continuous progress of exercises therapy has been repeatedly mentioned. The exercises therapy as the treatment and rehabilitation means for orthopedic disease has been widely recognized. Exercise therapy, also known as functional exercises and functional guidance, is an effective method for Chinese people to prevent and control disease, improve health, and promote recovery of limb functions through physical exercises. The exercise therapy implements the treatment principle of combination of exercise and rest treatment, which can promote the rehabilitation of bone and joint injury and bone disease after operation. Let's start by understanding the classification of exercises. Local exercises and systemic exercises, according to the site of exercises. So, the first, local exercises. Instruct the patient to take active activities of the injured limb so as to restore function of the limb as soon as possible and prevent tissue adhesion, joint stiffness, and muscular atrophy. If the shoulder joint is injured, practice shrugging the shoulder, swaying the upper limb forward and backward, clenching fists, etc. If the lower limb is injured, practice ankle joint extension and plantar flexion, quadriceps femoris relaxation and contraction activities, knee joint extension and flexation activities, etc. So the second, the seismic exercises. Instruct the patient to do seismic exercises for chi blood circulation and for restoring the visceral function as soon as possible. The systemic functional exercises can not only prevent and treat disease, but also compensate for the deficiency of prescription drugs. The systemic exercises can improve the function of visceral organs, improve the pathological and physiological process, restore and enhance the function of motor organs. So, what is the role of exercise therapy? The following points are summarized. First, promoting blood circulation, removing blood stasis, reduce swelling, and relieving pain. The second, nourishing of joints and tendons of the affected limbs after exercises. The blood flow is smooth with blood stasis displaced and new blood produced. The third, after functional exercises, it can not only promote blood circulation and remove blood stasis, but also produce new blood. The fourth, prevention and treatment of muscle atrophy. In case of fracture or serious tendon injury, active functional exercises should be done to make the soft tissue injury repair fast, heal firmly and function well, and reduce or prevent muscle atrophy. The fifth, avoidance of joint adhesion and osteoporosis. Because of the long-term fixation and lack of exercises of the affected limb, active and reasonable function exercises can promote the smooth flow of qi and blood and avoid joint adhesion, stiffness, and osteoporosis, which is an effective measure to protect joint function. The sixth, strengthen the body resistance to eliminate pathogenic factors. The exercises therapy can adjust the whole body function and promotes the filling of qi and blood with vigorous liver blood and kidney ascension, strong bones and muscles, and smooth joints. Strengthening the body resistance to eliminate pathogenic factors is beneficial to the overall recovery of injuries and the whole body. Exercises plays a good role in restoring limb function. However, attention should be paid to the following aspects during exercises. The first, contents and exercises intensity. To determine the exercise's contents and intensity and formulate an exercises plan, we should first identify the disease and estimate the prognosis, which should vary from person to person and from disease to disease. According to the physiological characteristics of injuries, we should choose the exercises methods suitable for each period under the guidance of medical staff. Especially for fracture patients, which should be treated by stages and parties. Action tips. Guide patients to exercise correctly is an important key to achieve good efficiency. The purpose, significance, and necessity of the exercises should be explained to the patient, making them work to accept it, give full play to their subjective initiative, and strengthen their confidence and patience in exercising, so as to actively exercise consciously, which is what we call the doctor-patient cooperation. The main purpose of upper limb exercises is to restore the function of the hand, while that of lower limb exercises is to restore the local bearing and walking function. The third, progress exercises. Strictly mastering the principle of progress exercises is an important measure to prevent aggravating damage and deviation. The actions should increase gradually during exercises from less to more times. The movement range should be from small to large, and the exercises time from short to long. Please note that haste does not bring success. The fourth, follow-up visit. Through the regular re-examination, we can not only understand the patient's condition and functional recovery, but also adjust the exercise's contents and intensity at any time and revise the exercises plan. Besides, please pay attention to the times of concentration when exercising, which should be general 2 to 3 times a day. During exercises, patients with fractures and soft tissue injuries may be treated with hot compress, fumigation, application of external medical water, physical therapy, etc. during the exercises. Moreover, it is necessary to adapt to change of the 4 seasons and keep warm. Next, let's watch several exercises videos.
Leg exercises can be sitting or standing position. Stand with your feet shoulder width apart. Breathe deeply with your hand on your waist and do the following: anti-flexion and retro extension. Push the neck forward doing inhalation. Make the lower jaw closer to upper edge of the manubrium sternum. Extend the neck posteriorly to the maxillum doing exhalation. Repeat 6 to 8 times. Left and right natural flexion. Head to the left doing suction. Head to its central position doing exhalation. And head to the right doing inhalation. Head to its central position doing exhalation. Alternate left and right. Repeat 6 to 8 times. Rotate left or right. Turn your head to the left doing deep inspiration. Head to its central position doing exhalation. Head to the right doing deep inspiration. Head to its central position doing exhalation. Alternate left and right. Repeat 6 to 8 times. Head forward and retraction. Keep your head in the central position doing inhalation. Extend your head forward as far as possible doing exhalation. Inhale deeply and retract the head with a little effort doing reduction. Pay attention to keep your body upright. Low swing back and forth. Repeat expansion 6 to 8 times.
Low back exercise method. Anti-flexion and retrotension. Stand with your feet shoulder width apart. Keep both lower extremities straight, and rest the arm on the hips for waist forward flexion and extension. Repeat 6 to 8 times. Try to relax the waist muscle when moving. Left and right lateral flexion. Stand with your feet shoulder width apart. Keep the patient's arm down and straight. Perform left lateral flexion of waist. Keep the left hand down the outside of the left lower extremity as far as possible. Reduction. Then, perform right lateral flexion in the same position. Repeat 6 to 8 times. Left and right rotation. Stand with your feet shoulder width apart and rest the arm on the hips. Rotate the waist clockwise and counterclockwise once. Then, rotate 6 to 8 times alternately clockwise and counterclockwise from slow to fast and from small to mighty force. 5-point support. The patient in the supine position. Flex the elbow and knee on the both sides, supported by 5 points of head, 2 legs and elbows. Support the waist with both palm and forcefully arch the waist. Repeat many times.
Flying swallows dipping into the water. Be in a prone position. Keep the patient's arm straight at his or her side. Raise the head and the shoulder over the rear with both arms, or raise the straight leg over the rear. Then the two movements are combined and performed simultaneously to form a flying swallow. Repeated many times.
Shoulders and elbow exercise. Protraction and retroflexion. Stand with your feet shoulder width apart. Make fist and put on your waist. Stretch one upper limb to anterior superior with force. Retract forcefully. Alternate left and right. Repeat many times. Internal and external retroation. Stand with your feet shoulder width apart. Make a fist. Flex elbow. With the forearm in supinated position. Use the forearm to circle back and force the internal and external retroation of the shoulder joint. Alternate arms. Repeat many times. Cross the finger and lift up. Stand with your feet shoulder width apart. Cross the fingers of both hands. Straighten both elbows with palm forward. The healthy limb helps the affected arm to swing left and right, while gradually lift upward, as long as the affected area is not too painful. Finger climbing wall. Stand with your feet shoulder width apart. Face or turn the body side to wall. Climb up slowly along the wall with affected finger. Raise the upper limbs to maximum, then return to the original position along the wall. Repeat many times. Both step and clawed hands. Both lower extremities are spirited anteriorly and posteriorly. Stand into a ball. Support the forearm of the affected limb with the healthy hand to move the center of gravity. Flex the elbow of the both upper limbs. Rest your forearms against your chest. Then move the center of gravity forward. Simultaneously extend the forearm of the affected limb in a clockwise or counterclockwise with arc at the same level. Alternate front and back. Repeat many times. Forearm west hand exercise. Forearm rotation. Put the upper arm against the side of the chest. Flex the elbow at 90 degrees. Hold the stick with hand. Rotate the forearm forward and backward. Repeat many times. Grasping about the palm flexion. Open the 5 fingers forcefully. Then grasping about the palmar flexion. Repeat many times. Dorsal extension and palmar flexion. Make a fist forcefully. Perform dorsal extension and palmar flexion of the wrist. Repeat many times. Lower extremities exercise. Lift and drive legs. The patient is in supine position. Raise the lower extremities straightly and slowly. Then flex the hip and knees and extend the ankles as far as possible. And then extend the leg anteriorly and superiorly as repeat many times. Rotate and shake the knee. Stand with both feet together. Bend both knees slightly into a half squat. Put both hands on the knee. Rotate knee joint, close side and counter close side. Repeat many times. Extension and flexion of ankle. Lying or sitting position is applicable, extending the dorsum of foot to the maximum. Then make plantar flexion to the maximum. Repeat many times. Ankle rotation. Lying or sitting position is applicable. Rotate the foot clockwise and counterclockwise. Alternate with each other. Repeat many times.
We will explain in detail the specific exercises methods in different parts. We have learned the exercise therapy here today, and we will continue to learn it in the future. So today is over. Let's see you next time. Bye bye.